Okay, so I am Luis Aguilar, and this is my leading change project. So I chose to do community nursing and workforce shortage. So I want to start off by saying that community nursing focuses on helping people in their own neighborhoods stay healthy. So nurses work to prevent illness, manage long-term conditions like diabetes, and provide care for mental health. They also make sure people can access healthcare services, especially in places with fewer resources. Community nurses educate families, run health programs, and offer support to help people live healthier lives. So their goal is to improve the health of the entire community. So before taking my community nursing class, I didn't realize how important community nursing is in healthcare. So as I learned more, I saw how it helps improve public health and patient outcomes. So I chose this topic because coming from a different cultural background, I've noticed that people from different cultures often don't seek medical help. This is an important issue that needs to be addressed to make sure everyone has good access to healthcare. So in community nursing, it's important to focus on preventive care, managing chronic diseases, mental health, and better access to healthcare, especially in areas with a shortage of healthcare workers. Preventive care helps avoid serious illnesses while managing conditions like diabetes and high blood pressure to keep people healthier. So mental health support is also a key since many struggle with the stress and limited resources. Lastly, making healthcare more accessible through outreach and mobile clinics ensures people get their care they need. So one way to help diverse communities facing a shortage of healthcare workers is by expanding mobile health clinics and hiring more nurses. So mobile clinics provide services like vaccines, screenings, and mental health support in underserved areas, making healthcare more accessible. And hiring nurses who speak different languages helps improve communication, trust, and understanding of care. So this approach can reduce missed treatments and improve health outcomes by making healthcare more inclusive and easier to access. Okay, so the resources needed. So to make this change happen, we will need funding for the mobile clinics, including vehicles, medical supplies, and staff. So we would also need to hire more nurses, which will require training and salaries. And additionally, we will need community support like partnerships with local organizations and access to technology for telemedicine or patient tracking. An effective team works best when there is a clear communication, respect for each other, and teamwork. So team members should bring different skills and ideas, which helps solve problems in creative ways. So trust and responsibility are important to make sure everyone works toward the same goal. The team should also be flexible and ready to adjust if things change or new challenges come up. For the barriers, some things that can make a team less effective are poor communication, not trusting each other, and not knowing what everyone's job is. So when team members don't talk openly or listen to each other, it can slow things down. Also, if everyone doesn't understand their role, it can cause confusion. And to fix this, we should encourage open talks, build trust, and make sure that everyone knows exactly what their job is. And this is my works cited.